Hello and welcome to the IHA, the Module 1, the first module of 5 modules. Congratulations! You're about to embark on a journey which is going to give you in-depth information about your subconscious mind, how to help people make change in their life through hypnotherapy and hypnosis. I'm really excited for you to be learning this because the self-development that's going to happen over this next 10 weeks is going to be quite immense. In fact, on average, 1/4 of the students that come on my hypnotherapy trainings do it for self-development reasons because they've been recommended by other people that have made such great personal development on this. So it's more than just becoming a hypnotherapist, it's becoming your own therapist, understanding how your mind works, which is going to create more peace and calmness in your life. You're going to see things from perspectives that you never saw before, understanding how your mind works more effectively. So you should have 3 books printed with you now as you're starting the course. Book number 1 is your assignments. So you will be using those at the end of every assignment so that you can do your tasks, your assignments, and your practical assignments also. So for the first 3 weeks, there is no practical assignments. Why? Because I need to know that you're a safe, effective, and ethical hypnotherapist. So we're going to go through the safety in the first module and your learning style, and then after the first 3 modules you should have a better idea as to how to position yourself, what you can say, what you can't say. Now I'm also very aware that there's going to be a large percentage of students watching this that have never done any interaction with the general public. So the first 3 modules is most certainly for you. However, I am also aware there are going to be counselors, psychiatrists, psychologists, even doctors that have been on my courses in the past that will be on this online course. So your idea of ethics and your moral perspective on how to deal with the general public is going to be a lot clearer, so you should be able to move through this faster. Yes, you're not getting out of it. I need to know everybody's on the same page. So let's start. Your hypnosis journey. If you remember Neo and Morpheus and their journey throughout the Matrix, very interesting. One of becoming more aware. Morpheus understood that there was more to his reality and was taking Neo through a process of self-discovery. And this is going to be quite similar for you in effect. Some of you are going to have no idea about the subconscious mind and how it works, and there's going to be a moment where you're going to be with a family member, a friend, or a relative, or even reflecting on yourself, and there's going to be ones and zeros moving down your eyes, and everything's going to make a lot more sense. Everything in your life is going to make better sense. You're going to have a better perspective on who you are and a better idea of how to help other people through this process. If you immerse yourself into learning, I promise you this, it will go quicker and your understanding of hypnosis will be embedded very firmly into your life. So why is that important? Well, everybody has a subconscious mind and you have a subconscious mind. So if you want more health, wealth and success in your life by learning this program thoroughly and how to communicate with yourself, you're going to be able to move through life a lot faster. If you want to be a certified hypnotherapist, then obviously immersing yourself into this information is going to create a better opportunity for you to be really good at what you do rather than just mediocre because you only applied yourself 50% as much as you could have done, which is your choice. I can't dictate what you do and what you don't do. So what's your why? The why is really important. Everything you've ever done in your life started with why, and a good reason to do that. Identify your why now, and the study for this over 10 weeks, at least once a day for 4 or 5 hours for 10 weeks, that's all, 10 weeks. And you will then complete module 1 and be certified for that. It's not only about learning the information. Anybody can just sit and learn. This is about going out into your everyday life, observing human beings, their capacity to evolve, and observing yourself and how your mind works, your habits, your phobias, your fears, and applying the philosophies that are taught to you through interactive hypnotherapy. And you will start to see examples of people holding on to things they can let go of, and how people are punishing themselves essentially for no reason, and that is their journey, and we can't criticize that, but we can become the observer. We can, like random molecules bumping into each other, just observe the other molecule to see at what stage they're ready to make change in their life. If they're ready to make change, you can offer your service. You don't have to even be a professional hypnotherapist, and I mean professional full-time. It's your only duty. You can do this as a hobby, and you can do it as a part-time profession for sure. So what you do need is willing participants to help you. Now, for the first 3 weeks, it'll all be about safety and understanding the mind and how it works. However, after that, you're going to need people to volunteer their mind so you can practice and become aware of the outcome. So find 2 to 3 willing participants, spark their curiosity, tell them that you're studying hypnotherapy and that you'd like to help them relax, that you'd like to introduce them to their subconscious mind, for them to experience hidden resources within them. Yes. Join the online Facebook community where you will be able to ask questions, and me and my assistants will be monitoring this Facebook group, and comments will be observed, and there'll be other hypnotherapists that I've trained 3 years ago that will be on there, and they will be able to guide you with information that you need. If you stay on track, so don't skip ahead through the assignments, do them systematically, because a lot of time, many months I've been planning this module and exactly what practical experience you're going to have as you go through. And if you look, is a page called Hypnotherapy Session Progression, which gives you an idea of each week and what kind of progression you'll be doing right to the end. So the very 10th week is you doing 10 steps of hypnotherapy, all in order, knowing why each step is important and when you can't take that step out. Managing your mental state is very important, because nobody's going to manage it for you. It's your responsibility to get your books, sit down and watch these videos and go through your manual and fill out the words. Nobody's going to do it for you, and this is why your why is so important. Now, there may be times that you feel overwhelmed. That's okay, because everybody feels overwhelmed at some point. So at that point, you can relax and step forward. Stepping forward is moving forward, and allow yourself to absorb the information. And in fact, your subconscious mind is listening to everything that you pay your attention to. So whether you think you got it the first time or not, it's there, And in fact, you can go back over this course as many times as you need. If you need to go over one section of the course, you can do, because you have all the videos. So if you feel a sense of being overwhelmed, relax, step forward, just move through that section, and you can come back to it at a later point. So if you have a lack of concentration, again, focus on your why. What's the outcome that this is going to create for you learning about hypnotherapy? Is it going to make you a better practitioner? Is it going to help you be a better helper of the world? Think about the times that you struggled helping people, and how much more effective you will be once you learn hypnotherapy. So if you have an old habit of self-doubt, once again, be present. In the present, it's called a present for a reason, because it's a gift to you. And in the present moment, there is no anxiety, there is no stress, there just is. So if you're feeling self-doubt, that's coming from old programs of the subconscious mind. And you can be present in that feeling and negotiate with it. So notice that and step forward from that state. You are in control. You are in control. Stages of learning. The first stage is unconscious incompetency. So this is wrong programming. So you will have picked up information from your friends, your family, TV programs, reading in some books. There's still some bad information about hypnosis and hypnotherapy. There's a lot of antiquated old information that needs updating. So you're unaware of this information that's in your mind. That's the first stage that you're at. And then it will become the second stage, which is your conscious incompetence. You'll start to get to know how little you actually know. And this is where the wrong analysis takes place. And then as you progress throughout the course, you'll go to the third stage, which is conscious competency. So you know that you know now, and you can now analyze the information and move forward. And then you'll get to the fourth stage. This is the stage where you've done something for a long time and it just happens automatically. So this is unconscious competency. So you'll be with friends and family, and you will automatically see the ones and the zeros, and you'll know exactly where they are in their progress of their personal development. You will see phobias and fears, and you'll be able to interact with your family and your friends on it, and you won't even realize you're doing it. It'll just be so natural to you, and it's an amazing place to be. Does it always happen? No, absolutely not, because we're human beings, and sometimes our consciousness is in other places, and that is okay. That's okay. So the style of teaching that we're going to go through, you're going to have subjects, and each subject is going to come with its own depth. Now, the depth can go on for a very, very long time. And some courses can be quite boring with their depth. So what I've done is taken out all the stuff I don't think you need. In fact, and how do I know that? Because I'm only going to teach you what I use in my professional practice. So when I sit with my high-profile clients, celebrities, royalty, movie producers, I know what information constantly I talk about. And I know what I've learned from the past, which is totally irrelevant. It's not helping me. It's not helping my clients. So I'm only going to give you the depth that I feel you need, and also the depth that I use in my practice. Can you carry on learning? Absolutely. The depth is limitless. So you're learning something new. So in the beginning, I would like you to have a strict practice in what you're learning. So very much like driving a car, 10 to 2. And you drive with your seatbelt on, and you always check your mirrors, and you always stop at the junctions. You never go into second gear and coast round. No, because that's not how you learn how to drive. And as you do this, you're going to have a very firm idea of why each of those 10 steps are where they are. And then you can create your own style. And through your own style, know why you would miss out certain steps, take shortcuts, and I'm going to teach you how to do that successfully. Hypnotherapy skill levels. This skill that you're learning in Module 1, you can't bypass it. It's very much like learning how to write. You have to learn the ABCs, and then you form words, and those words form sentences, and those sentences form paragraphs, and then books. So you can't skip the ABCs. You have to do the ABCs. So you're going to learn how to create scripts, why they're written in a certain way, and this is going to empower you to read other people's scripts with a critical eye. Now, you could be doing another hypnotherapy course written by somebody else that maybe doesn't have as much experience as I have, and they will just have reams and reams and reams of scripts that they expect you to use every time you have this client. Identify this symptom, this script. That is disabling you from being an amazing hypnotherapist. So there isn't lots of scripts in here. However, I'm going to be teaching you how to write your own scripts and how to know when a script is actually antiquated. It's come from a very old place. And a lot of hypnotherapy has come from an old place, and it's evolved since then. So second stage, write your own scripts. Third stage is client amended scripts. So you can get information from your client and then start writing your scripts afterwards. All of those are quite limiting and hard work, to be fair. So module 2 and 3 is where I teach you how to tiptoe through the subconscious mind of your client. And I teach you different boundaries and ways to use metaphor, which is a lot more freeing. No more script writing is needed, but you have to do your ABCs, I'm afraid. And then the last stage is creative interactive hypnotherapy, where you will have many different metaphors and stories and understand the important principles of the subconscious mind, so you are able to navigate, not leaving any of your footprints behind, creating very safe, effective, ethical sessions for your clients. No diagnosing. We are not licensed as hypnotherapists. So society has their own idea of what's more mainstream, which is counseling, psychology. These are mainstream modalities that people use in their life. A psychiatrist and a doctor will prescribe medication. At this stage on module 1, if you have people that come to see you and they are on medication, I would suggest that you don't have adequate amount of training to be able to manage their expectations or have enough experience to identify if you can help them or not. So I would strongly suggest that you don't interact with anybody that has that's being guided currently by any psychiatrists, doctors or psychologists, because with your lack of experience there may be an opportunity for you to do something that you shouldn't have done and get yourself into trouble. And that I would like to make a very clear line in the sand now to say module 1 to stay away and just say and be honest. You don't have the level of experience that's necessary to be able to interact with people that have symptoms that are currently going to psychiatrists, doctors, psychologists and counsellors. So psychiatrists and doctors are only licensed and insured to discuss medication and the use of it. As hypnotherapists, we are not regulated, insured or monitored to discuss medication. If you go to page 12 of the assignment handbook, the AH, there is more details there on this section. Module 1, Objectives. Learn the principles of interactive hypnotherapy, and these will stand you very well as you grow through the modules. Master the 10 steps of a hypnosis session. This is really important. And when you get into the next modules, you will need to know the process off by heart. So learning the steps is very important. Practice your skill as often as you can. Now, hypnosis and hypnotherapy is very effective for helping people alleviate stress. So with anybody in your environment, you can take them into a trance state and help them alleviate and relax. Progress to the next level for full certification. So what does full certification mean? Well, as a hypnotherapist, you want to be interacting with a full skill set. Scripted hypnotherapy is very limiting. At best, you'll get an approximate 30% success rate with scripted hypnotherapy. And as you start to go into Module 2 and Module 3, your success rate will increase exponentially. You'll be a lot higher when you learn those techniques. You can go to page 13 of the assignment handbook and read in full the objectives of this module. Ethics and ecology of hypnosis. So number 1, create the best experience for your client. So that means that we are constantly working from a positive perspective, and we are focused on our vocabulary and the way that we project ourselves. I was once leaving a newsagent's in Manchester, and as I looked down at the paper stand, I could see on the front page there was a hypnotherapist in the city centre advertising stop smoking sessions. And I remember looking at the paper thinking, good for you. Excellent. There needs to be more hypnotherapists in the world explaining how the mind works from a subconscious perspective. I was really impressed and happy that I saw that. And then maybe a few weeks later, I bumped into a friend of mine, and his friend had been to see this particular hypnotherapist to stop smoking. And I asked what the session was like. And he promptly told me that his friend had left with a phobia. That isn't the goal. When your clients come to see you, they should leave with less than what they came to see you with. That's the goal. And what actually transpired within the session is this hypnotherapist had taken his client into the subconscious mind and asked him to imagine something which was negative. And that negative imagery created a phobia within that particular person. So create the best experience for your clients always. Your client's confidentiality can start today, even with your friends and your family. And if it starts now at a very high level, then we can be guaranteed when your practice grows and your clientele and your clients are more elite, they will feel confident when they're talking to you that their confidentiality is going to remain private. And when you're dealing with elite clients, it is important to be professional and not discuss any of their private information with anybody else. When I came to Thailand and I met my wife, she had a medical spa, and on the top floor I had my practice. And my clients would come in and sit in reception, and they'll be looking one way, and then they'll come up to see me and they'll do the session and let go of what they needed to let go of, which is their choice. And on the way down, they'd often be smiling and happy with the process. And all my wife saw was them come in, go upstairs, come back out and leave smiling. And she used to ask me, so what did they talk about? What did they say? And every time I would say to my wife exactly the same thing. I can't tell you, because I don't want to discuss somebody else's life. And the main reason for that is because it would stay in my mind, and I don't want to pollute my mind with other people's problems and challenges. That's the first reason. The second reason is their confidentiality. Discussing somebody else's private life, it's not essential. So start now creating a habit of confidentiality with your clients, and it'll serve you very well when you have more elite clients. Have a professional manner, appearance and behavior. And again, when I came to Thailand and I had my practice on Koh Samui, Koh Samui is an island, southern Thailand. It's quite a small island as well. So people very quickly get to know who you are and what you do. And within that area, I was known as a hypnotherapist and got referrals all the time. So how did I dress? I wore a shirt most of the time. How was I perceived? I was always perceived from a professional perspective, because your image and your integrity can take a long time to build. And the way that people perceive you as a professional or not can take a long time to build. And it only takes 1 second to destroy. So not coming across in the right way, not being aware of how you're communicating verbally to your friends or your family or people that are in your social circle can either deconstruct or construct your professionalism. So be aware of that. Suitable working conditions. It's important, if somebody's going to come to your apartment or your house, that everything in that apartment or your living environment is neutral. So if you are religious, that's okay. That's okay. If you are a Christian, a Catholic, Jewish, or a Muslim, you don't have to have all of the things around that show somebody what religion you are. You don't have to do that. So you can put them to one side. Even as far as wearing perfume or aftershave whilst you're conducting a session, the smell of something can trigger a memory very, very quickly. So better not to wear anything that's going to trigger anything within your clients. Make sure your house is tidy and clean. If you have pets, if you have dogs or cats, somebody that has allergies to animals will not want to be in a house. So you might want to ask, if you do have pets, if somebody has allergies. And if somebody's coming and they're wearing a black suit and they sit down in a seat and a cat's been sat there, they're going to have cat hair all over them. So make sure that your environment is professional for you to hold your practice. Because all of those things mentioned, if a client leaves and has had a bad experience, is offended in some way, it's not their fault. It's because the environment wasn't set up for a public practice to be held in. No medical advice. We've covered this, but it's worth covering once again. We're not licensed or trained to give medical advice now. There is a way to do it. I won't be teaching it in module 1, but there is a way for you to move around people that are on medication. But right now in module 1, there's not enough experience or need to know that, because what comes with experience is wisdom and knowledge. And the more people that you hypnotize and the more people you help let go, better you will understand what your boundaries are. But for now, just be aware that you cannot advise or give suggestions for people that are on medication. Clients' ideals and beliefs must be respected at all times. This is paramount. whilst you are bonding with your client, if you're different from them, then they will create a boundary. And the idea as a facilitator of change is actually to break the boundaries down. So I have friends that are Catholic, that are Jewish, that are Muslim, and I sit with them and I listen to their perspective. And I do that because I know at some point it's going to help me build a relationship with somebody. So I once had a friend that was a Mormon, and I listened to all the information about their guidelines and their philosophies. And I once had a client that was a Mormon, and because I understood and I had an idea of his ideas and his beliefs, we were able to build very, very quick rapport and bonding with that person. Now, does that mean I want to be a Mormon? Absolutely not. But to know something about that helps you. And the only goal is for your client to let go and for you to facilitate that. So learn as much as you can about other people, their beliefs, their values, their ideas, because it will serve you as a practitioner, as a facilitator of other people's change. The client's welfare is paramount at all times. It is your sole responsibility. Dealing with the public, anybody can come to your practice, whether it's at your home or you have an office, and their welfare is extremely important. And that is the only thing that needs to be thought about. Are they safe? Are you communicating with them in an ethical, effective way? Are you helping them? Page 14, the assignment manual will go more into the ethics, and there is an assignment on this. Next, we're going to cover the hypnotherapist's responsibilities. Master the art, learn the science. And it is an art and a science. The science is very limited. Why? Because what I'm going to teach you is all that you need. However, you do need to learn what it is that I use in my practice. This will allow you to answer any questions that your clients have in an effective way. The science that I'm going to teach you about the mind is adequate enough to deal with any client at any level. I promise you that. It is an art, and the more that you practice, the better you will be. The more you practice the 10 steps and everything that's involved in that, the more effective you will be, and you'll start to see personalities and know how to adapt to different people, different beliefs. Be 100% invested in a positive outcome. I know this is the third time I mentioned this, and that is how important it is. All about positivity. And I know sometimes our mind can go towards the negative. And as a professional hypnotherapist, this is where your personal development can grow and start to notice more of the positive around and be able to navigate people from the negative to the positive. You are in your client's story, not the reverse. So what does that mean? Often in some therapies, I don't want to mention because I don't need to, it's almost as if the hoop of change, the client has to jump through it. However, with hypnotherapy, it's the other way around. As hypnotherapists, we do our best to navigate through our client's subconscious mind, utilizing everything about them to create the outcome that they need. So we have to change around our clients, not the clients following our regimented rules of process. Absolutely not. And that's what I'm going to teach you. I'm going to teach you how to change and which clients you need to do more change with to be able to help them. Hypnosis is feminine, not masculine. And there are some therapies out there that are very masculine, like NLP, for example. NLP is very directive and masculine. This is the first point, this is the end point, and we're going to get to here, and we're going to do it through my direction. Well, hypnosis and the subconscious mind actually is very feminine. So we have to change our masculinity and femininity to manage our clients. So how do we do that? So if you are a man in your masculine predominantly, and you have not experienced your feminine, because the masculine and the feminine has got nothing to do with male or female, absolutely not. In fact, different countries are masculine or feminine. So if you went to New York City, then everybody's walking, nobody's looking at each other, they're just getting to their destination. It's very, very masculine. But if you go to Hawaii, then everybody is more gentle, more lingering, more willing to talk, go with the flow. So even countries have, and states and cities have more masculine or feminine feel to them. So what is the masculine? The masculine is about direction, scheduling. It's about an outcome. And if you get two people in their masculine sat talking about something, there has to be a conclusion. There has to be an outcome that's reached, because that's the masculine essence. So if you get two women in their masculine or two men in their masculine, they will be following those guidelines. And then once it's completed, that is it. Maybe next subject, or maybe not the next subject. However, if you get two men in their feminine or two women in their feminine, so they could be in a coffee shop, drinking coffee, eating cake all day long. And if you asked either of them what they talked about, they wouldn't probably have any idea. Why? Because the actual conversation had little to do, it had more to do with how they feel in the conversation. And that's the feminine, feeling, enjoying, being present is the feminine. But the masculine is about the future. It's about achieving direction. So, how does this affect your practice of being a hypnotherapist? I can tell you, as a man in my masculine, I had to practice being in my feminine more. And now I can switch whenever I want. So the feminine is about listening, using these in the ratio that they've been given. Listening twice as much as we talk. But the masculine is talking more, directing more. So if my wife comes home from work, she has a business, and she wants to talk about her business, and I'm in my masculine, because she's talking about business, she's also in her masculine. And if she needs to talk to come to her own conclusion, and I give her the conclusion with my masculinity, we fight. Why? Because in her masculinity, she's searching for femininity within me. And if I adjust myself to listening, and she gets to find her own conclusions, her own direction, she feels supported in that process, and the process is complete. So we have to shift or be aware of our masculinity and our femininity in our relationships, in our practice. Because when a client comes to see you and he wants to express, we need to be able to listen. And we're going to cover active listening in this course for you to practice and become better at doing that. Know your limitations. Start small and practice. You are going to be limited anyway, because Module 1 is very limiting. However, you could after module 1, start getting scripts online, and dealing with more complicated challenges like helping people stop smoking. Now, as a professional who is actually specialized in stop smoking for nearly a decade, I can tell you using a script for hypnotherapy isn't enough. However, the majority of hypnotherapists out there will do exactly that. And that's why my success rates are always averaging around 70%. More than, and that is a lot more than the national average for a scripted hypnotherapy session. So follow the modules, start small. If you jump ahead to more complicated, you might get into a habit of using scripted hypnotherapy and it won't serve you, and you'll fall into the trap that every other hypnotherapist falls into, which is I need a script, I need to follow some structure. The subconscious mind is very feminine, doesn't follow structure at all. So we need to adjust to that. Yeah. Empower your clients all the time. When they come, we help them see their challenge from a perspective that empowers them, helps them look at it from a different angle. And in doing that, it helps them overcome. So we support, we nurture, we guide our clients, always empowering. Learn the philosophies and the principles of interactive hypnotherapy, and these will serve you very, very well. Page 4 to 6, scripts and principles, and this will be in your first assignment. Symptoms hypnosis can treat. As a hypnotherapist, we only see the possibility to change. What clients present is their lesson and should be treated as such. The lesson is the symptom, it's not the cause. The cause can be something very, very different. I'll give you an example. A lady came to see me to stop smoking. We did the session and I said, let's speak tomorrow, see how you get on. We spoke the next day. She said, I'm not smoking, however, I'm still craving. And a craving is how the subconscious mind communicates with the conscious mind. A craving is an emotion. A craving is only the subconscious reminding the smoker to complete a task. So I knew the session wasn't successful. On returning, we actually did a different type of hypnotherapy and communicated with the part of this client that continued smoking. And the evidence that was given was that the smell of smoke reminded this lady of her dead sister who she'd never have mourned. So every time she had a cigarette, she was thinking of her sister. So the cause of her smoking and continuing to smoke had little to do with nicotine. It had little to do with anything else, in fact, but this reminder of somebody that she loved very dearly. And once the grieving process had continued, or completed even, she became a non-smoker. So the cause isn't the symptom. We have to deal with the symptoms, or observe the symptoms separately, and I'm going to teach you to do that. So page 16, go through all the different symptoms that are there, and if you don't understand some of them, just Google them and find out what they mean, because the more symptoms you understand the meaning of, the more professional you will look when your client comes to you and says, I have this, and then you'll know what it is and how to help that person. So what are you studying? Hypnotherapy is a rare form of communication Using hypnosis for therapeutic result. When to diagnose and facilitate instant change. Not everybody is ready for instant change. And we need to know who is and who isn't. And I'm going to be teaching you that in this module. How to use the trance state for a therapeutic outcome. It's an interesting word, trance. We can also call it an altered state of awareness. Trance is a very normal, everyday experience. And we slip in and out of a lower frequency of the mind very often, very often. Hypnosis should be treated as a different language form, a language within a language. And why is that? Because the subconscious listens in a very particular way, and we can use language patterns, and different types of words are more effective with the subconscious mind. And over this module, I'll help you identify which words are more powerful for the subconscious mind, and which words the subconscious mind doesn't utilize at all. And then I'll teach you how to use these words in sentences that make no sense to the conscious mind, but very effective with the subconscious mind. And that's why it's a language within a language. So the 10 steps of a hypnotherapy session. So the first step is bonding. Some people call it building rapport. However, building rapport is a process, and a lot of building rapport can actually break rapport. So bonding is the result, and the objective of bonding is trust. We're building trust within our client. Why? Because if your client doesn't trust you, their subconscious mind will not trust you at all, and the doors will be closed and locked. So the trust that's built between you and your client is facilitating you being able to speak to the client's subconscious mind. Bonding. Number 2, consultation and reframe. This is the empowering perspective, because once you've received what it is your client wants help with, you can then find a new perspective that helps them understand the reason why, the lesson behind. And there is a lesson behind absolutely everything. That's why we're here, to learn, to evolve. And once we start learning to see the lessons of life, and the more that you help your clients see their lessons, the more you'll start to see your own lessons. And that's a fascinating process. Step 3, the pre-talk. The pre-talk is to resolve expectations. Most people will expect something very different from a normal experience. And when we manage our clients' expectations, that means that there's no questions going on in their conscious mind whilst you're dealing with their subconscious mind. If there is a question, that means they're distracted, and that means that they are not giving you their full attention. And that means the subconscious mind may also question the process. So the pre-talk is very, very important. The induction. Induction is almost like opening the mind's door, allowing the process to start. The induction is relaxing, and it can be focused around what is most relaxing about your client and their experiences as well. So they may like going to the beach, they may like sitting on a mountain. If you start to use an induction with a client who doesn't like mountains, scared of heights, doesn't like the sand between their toes, is that going to help them? No. That's why getting to know your client and what they like is important. The deepener. So we've opened the door of the mind, and the deepener is stepping in and going down as many of those steps as that client needs, because everybody's completely different. And then we have number 6, which is the suggestion and metaphor. This is where the experience change, if they're ready for the change, which is a different story altogether, and we'll cover that later. Number 7, future pace. So we are reinforcing the change that the client has gone through, and they can experience a little of what it would be like to have changed in the here and the now, to know what to expect after the session. Number 8, a post-hypnotic suggestion. Post meaning afterwards, hypnotic suggestion. That means that it can be triggered at a later date, which reinforces the change. Number 9, emerge from trance. Bringing your client back to full waking consciousness, able to use their full critical faculty, fully aware of everything in their environment, able to respond in a timely fashion as normal. Number 10, results. Because as an interactive hypnotherapy, we are results orientated, which means we are able to identify within the session if it was successful or not. We take responsibility for that as an interactive hypnotherapist, where most hypnotherapists will read from the script, really not know what's going on, and they'll be scared to ask or to identify if it worked or not, because they don't really know. Why? Because it was a one-way process between them and their client's subconscious mind, where interactive hypnotherapy is a two-way process. There's always feedback through the session, and that's how we give the client responsibility to change. It's not our responsibility, which we'll be covering in the print. So well done, you're at the end of assignment 1. And this is probably the driest assignment that you're going to have, because you're learning rules and regulations and things that you don't know why you're learning them yet. However, let me tell you this. Apply yourself now to the ethics and these rules and regulations and the principles of interactive hypnotherapy, and it will make you a better hypnotherapist. You will be respected more by your clients because you'll have a deeper understanding and a higher integrity than most hypnotherapists out there. So bear that in mind with this particular assignment. It's going to be the foundation of your success in a big way. So to end this video, I'd like to tell you about a client that came to see me, and for his privacy, I'm going to change his name to Tom. Now, he has given me a testimonial, however, he didn't give the details that he came to see me for. So that's what's making me change his name for his privacy. Tom came to see me, and the first thing he said to me was, I'm bipolar. Bipolar is a label given by psychiatrists and psychologists to suggest that somebody has extreme mood swings from happiness all the way down to sadness and what's considered clinical depression. So his mood would constantly, his mood and behavior would constantly been swaying backwards and forwards. Now, this particular session was started with some coaching, and the coaching led to hypnotherapy. And at the beginning of the next video, I'm going to share with you what the outcome was of this particular session for bipolar. So congratulations for finishing this assignment, and I'll see you on the next video.